สวัสดีครับ Good afternoon, ladies and gentlemen. I am Tanongsak Panyawirunroj, plastic surgeon from Siriraj Hospital, Mahidol University, Bangkok, Thailand. I am appreciated to present my paper about the inhibition of collagen type 1 synthesis in keloid fibroblasts with short interfering RNA. Keloid is a fibroproliferative disorder. The components in keloid scar are heterogeneous. Nevertheless, collagen type 1 is predominant among all components. Therefore, suppression of collagen production might be useful for treatment of keloid. Recently, Andrew Fire and Craig Mello have described the introduction of small interfering RNA into a cell can cause a specific silencing of gene expression known as RNA interference. This is protein synthesis model, DNA transcription to mRNA, then mRNA translation into amino acids. This is protein. And we plan to design a short interfering RNA. Short interfering RNA is double-strand RNA. Its length about 19 to 23 nucleotides. It's working by catching two complementary mRNA and destroy it, then no protein expression. In this study, we design in collagen type 1 synthesis. mRNA COL1A1 produced pro-collagen type 1 alpha 1. mRNA COL1A2 produced pro-collagen type 1 alpha 2. We design siRNA COL1A1 to destroy mRNA COL1A1. And for specificity design, we design siRNA COL1A2 for destroy mRNA COL1A2. The objective of this study, small interfering RNA specific to COL1A1 and COL1A2 genes were designed and used to suppress expression of the mRNA COL1A1 and COL1A2 in culture keloid fibroblasts obtained from the clinical specimens. This is 4 steps in this study. The first step, keloid fibroblast culture. We use fibroblast culture because of it have no study about siRNA in human body before. The second step, design and generating siRNA. Third step, transfection of siRNA into keloid fibroblasts. And final step, RNA extraction and quantitation of COL1A1 and COL1A2 mRNA levels. The first step, specimen was obtained from a 20-year-old female patient. On her earlobe, lesion persistent more than 1 year and have no history of steroid injection or radiation. This is the fibroblast culture. We fed it with culture medium every 2 days. And we spend the time about 3 months for culture. We culture it until it's healthy, like in human body. The second step, designing and generating siRNA. The sequences of mRNA of COL1A1 and COL1A2 genes were obtained and aligned by bioedit program. Now we know sequences of mRNA, but we don't know which segment is proper for design siRNA. Donse and Picard present criteria for the rational design of siRNA by using the nucleotide content and its position. Then they are scoring. In this study, we design 4 study groups of siRNA. The siRNA COL1A1 21 nucleotide, 23 nucleotide, and siRNA 21. siRNA COL1A2 21 nucleotide and 23 nucleotide. By Donse and Picard scoring system, we use the high score for design siRNA sequence. And all of the 4 groups, we use only the high score. The candidate siRNA were then evaluated for the absence of common single nucleotide polymorphism and significant sequence homology to other non-target genes using BLAST. For generating siRNA, the siRNA specific to COL1A1 and COL1A2 genes were obtained from drug program, which facilitate the identification and design of siRNA synthesizers use T7 RNA polymerase. Finally, 4 siRNA are constructed. This is 4 sequence of siRNA. And negative control siRNA processing a scramble sequence was also designed. After we have the siRNA and we have the cell, the third step, the transfection of siRNA into keloid fibroblasts, we using the lipofectamines for media. And finally, RNA extraction and quantitation of COL1A1 and COL1A2 mRNA levels. We use the RT-PCR analysis. The result. This is mRNA COL1A1 expression. On the column 1 is DNA marker. On the column 2, we treated with siRNA COL1A1 21 nucleotide. It presents less blight when compared to the other columns. That means the siRNA COL1A1 21 nucleotide can decrease mRNA COL1A1 expression. For the other hand, mRNA COL1A2 expression. You can see the column 4. We treated with siRNA COL1A2 23 nucleotide, and it disappears off the column. That means the siRNA COL1A2 23 nucleotide decrease mRNA COL1A2 expression. We can see scramble sequence cannot decrease neither COL1A1 mRNA expression nor COL1A2 mRNA expression. siRNA COL1A1 21 nucleotide can specific decrease up to 90% of COL1A1 mRNA expression and cannot decrease COL1A2 mRNA expression. For the specificity, siRNA COL1A2 23 nucleotide highly specificity decrease the COL1A2 mRNA expression and not affect to the COL1A1 mRNA expression. The conclusion. The siRNA targeting collagen type 1 was an efficient reagent which to reduce mRNA of intracellular pro-collagen type 1 production more than 90%. It could be a new promising therapeutic approach for improving skin wound healing and inhibiting progression of fibrotic condition by interrupting the collagen type 1 production. Thank you.
Thank you, Dr. Panyawirunroj. Thank you very much for your excellent work and nice presentation. Is there any question in the floor?
Any question?
No question. I would like to say, because the next paper closely related to your article, and according to your result, it might be one of good treatment option in keloid. But as you know, the keloid formation is very complex, influenced by several factors: tension, skin color, inheritance. So how do you think to apply this system to keloid patients? So what is the first thing and what is next going to be your step?
And because of the keloid is the problem of the Southeast Asian patients, and it's maybe problem when I make the incision or the plastic surgeon make incision, and it have long time that cannot control and improve the result from the keloid treatment. That in this time is the gene target therapy is the improve, and maybe can this treatment in the DNA level treatment with our plastic surgeon treatment. Then this is only the beginning, and if we can try after this research, we can tie it into the human body, and if it works, it maybe help us to improve the wound healing or the problem of the overproduction of wound healing. And the next time, we try to research to the move the siRNA into the human body.
Thank you very much. Okay.